Hello, I'm Makayla. Along with my group mates Karissa, Bailey, and Katie, we researched adverse childhood experiences and their life effects, also known as ACEs. Okay, so ACEs are exposure to traumatic events that happen during childhood and adolescent years, so like 17 and under. Traumatic events in childhood can be very distressing and affect people throughout their life. So the nature, frequency, and seriousness of the traumatic event, any prior history of trauma, and available family and community supports can affect how the child responds to this trauma. So ACEs can include physical, emotional, and sexual abuse, physical and emotional neglect, and household challenges such as mental illness, parent treated violently, divorce, incarcerated relative, and substance abuse. Substance abuse can include things like alcohol use, opioid misuse, anything that's dysfunctional. And so this is just like the official ACEs. Other studies have shown other traumatic experiences.
So for the general effects of ACEs, there are several identified by the CDC to have pretty long-term effects on people. The ones mentioned here in this infographic are injury, and this includes things like traumatic brain injury, mental health, maternal health, infectious disease, chronic disease, risk behaviors, and opportunity. Our research was a little more focused, so we kind of honed in on some of these subjects. So our presentation will go a little bit more in depth on risk behaviors and substance use, mental health, life opportunities, and intergenerational impact and familial relationships.
Okay, so this is the ACEs whole life perspective model. And it just shows how ACEs affect people from conception to death. It starts with the ACE, which leads to social, emotional, and cognitive impairments, which then leads to the adoption of health risk behaviors, which can be substance misuse or risky sexual behaviors, which then can lead to disease, disability, and social problems, which could be things like Bailey spoke on as heart disease, obesity, which then can lead to early death. So the reason why ACEs is so important is for occupational therapists and healthcare professionals to understand ACEs, to interrupt the cycle across generations, assure that all individuals reach their full potential and they have a healthy development. Many professionals feel undereducated or uncomfortable effectively treating those individuals who've experienced ACEs or trauma. There is trainings that we'll go into a little bit. One of them is called PATH, which is Professional ACEs Informed Training for Healthcare Professionals. And this can help provide substantial education on evaluations, assessment, patient education, trauma-informed care, and interventions planning for ACEs. So for life opportunities, ACEs can negatively affect them, and life opportunities is going to be broken up into 3 different areas: education, employment, and income. Those people who have experienced ACEs can have a ripple effect with all 3 of these, and can be relatively firm in adulthood. So for education, ACEs and their associated toxic stress can impact a person's neurodevelopment, physical health, and mental health. There's a strong association of ACEs between intellectual disabilities, headaches and migraines, developmental delays, learning disabilities, ADHD, and anxiety problems. This can also lead to the reason why they might have lower grades, more discipline referrals, more repeated grades, higher rates of truancy, and school expulsion. Children with ACEs can also have difficulty with adapting to school context and may therefore be suspended or not obtain a high school degree. Next is employment. With 4 or more ACEs, there's a reported period of unemployment. Also, with no educational attainment, there is more likely to not have a skilled job. And ACEs can also lead to interpersonal relationship issues, somatic symptoms, emotional distress, and substance abuse, which in turn can affect their work performance. Other reasons for unemployment may include poor work performance, long-term absences from personal injury, related accidents, and chronic illnesses. Lastly is income. Studies results show youths who have experienced maltreatment, sexual abuse, and severe neglect are nearly twice as likely to have a low family income and 3 times more likely to live in poverty. So individuals who reported ACEs are 14% less likely to be employed, significantly less likely to own a bank account, stock, vehicle, home, and reported $8,000 less per year on average. So the abuse and neglect are more common in families in lower socioeconomic status, and higher income and education are linked to lower ACEs score, while lower income and education are linked to higher ACEs. So this is the reason why focusing on education, employment, and income can affect ACEs and life opportunities.
So we also looked at intergenerational ACEs. So just specifically, we looked at the maternal and paternal side. So how a mother or father having ACEs would impact their child, both developmentally and just in life, and maybe ways that that could be prevented. So with each additional ACE point on a woman's data, it showed significantly increased risk for their child to be traumatized and for the mother's stress score to be really high. So that was like a dose relationship. So every time they had more ACEs, their stress score was significantly higher. Moms who reported high ACEs scores but had the presence of support reported fewer issues with their offspring's behavior and improved social and emotional function. So it kind of was a buffer in a way to prevent children from having as many negative outcomes from ACEs. And then the effects of early adversity also were lessened when mothers had that high level of support. So even just the child having some of the developmental things that showed up with some children have ACEs that didn't show up. And finally, the mothers with depression reported less support and had higher chances of their children being exposed to violence and having further behavioral issues. So as you can see, support was a big part in the mother's ability to not pass ACEs to their children. Paternal relationships were a little different in terms of research. There was less research overall, and the paternal research primarily addressed the potential that children would pick up negative behaviors that their father had kind of done, whether that was abuse or emotional abuse, sexual abuse, whatever it was what it kind of dug into, which was interesting. It did find, obviously, fathers who've seen abuse are more likely to be abusers themselves, and the same is true for a child that's seen abuse. They're more likely to also be an abuser. And didn't say a lot of how support would impact maybe that. It just said the lack of relationship due to the father's abuse. The relationship was not close, so that's what kind of led to that, they found. And then the one interesting thing was a history of ACEs did not affect the father and son engagement, although it was correlated, but it did, it did affect the engagement, but it didn't necessarily correlate to them not being close. So a father and son still might be very close, but their relationship maybe wasn't positive, but it didn't mean that their closeness was impacted, which was interesting. And finally, with this one, they found that greater warmth, co-parenting, and parent knowledge were found to increase closeness of a father and a son, while stress and depression were found to decrease that relationship and closeness. So I think, again, it just kind of speaks back to there are other factors going on. ACEs is part of it, but there are some underlying mental health stuff going on, both with maternal and paternal ACEs. So it's hard to say. And then the general impact, stronger support systems are needed for impact of ACEs to not be passed to the next generation. And further research is needed to really determine the impacts of differential ACEs.
As Katie and Karissa kind of spoke on, ACEs do definitely have a very large impact just generally on someone's life, but those circumstances that they spoke on, such as familial relationships and life opportunities, can also have an effect on mental health. So for mental health, we focused a lot on depression, anxiety, and suicidal behaviors, but there was also some research that we went over regarding mental health in general as it is affected by ACEs. So overall, ACEs have been linked to anxiety, depressive, psychotic, conduct, personality, substance misuse, and other disorders. However, it's really important to note that positive experiences have potential to mitigate these negative effects that ACEs can have. So it's really important to identify those ACEs and get intervention as soon as possible, because that's when you'll have the minimalization of the negative effects. It's also important to recognize that the effects ACEs can have on mental health may not manifest as a clinical diagnosis, but it can also manifest as multiple diagnoses or just one. It all just really depends on the individual and their circumstances and how they are affected by their ACEs. It's also important to note that other circumstances should be considered. An ACE or multiple ACEs is not going to essentially determine how someone's mental health will display, and other factors have an influence on that. But for depression specifically, depression as a psychological disorder affects circumstances within general life, such as risk-taking behaviors and social exclusion. The CDC also found that depression is one of the leading causes of disease and disability in the youth population, so it's pretty important to cover. In our research, we also found that each of these specific diagnoses had relevant ACEs related to them, and for depression, those were child maltreatment and family dysfunction. Emotional support and external resources for depression specifically can help influence resilience, and resilience has been shown for all of these to be really positive and have a positive effect on these circumstances and the effects that ACEs can have on mental health. For anxiety, anxiety is actually one of the most commonly linked disorders to ACEs, and it's super prevalent in the United States, with over 25% of adults reporting anxiety symptoms or an anxiety diagnosis, which is about 1 in 4 people. The most relevant ACEs related to anxiety are physical abuse and parental divorce. And as I mentioned, resilience is key for anxiety as well to minimize those effects. As far as suicidal behaviors go, we found that there's a graded relationship between ACEs and suicidality, which basically means that the more ACEs someone experiences, the more likely they are to engage in suicidal ideation or suicidal behavior. In one study, we found that over 5% of the participants reported suicidality in the previous month, which included attempts, ideation, and seriously considering creating a plan. And while that might not seem like a high percentage, there were several thousand people that participated in this study, so it did come out to a pretty high number. And then finally, for the relevant ACEs for suicidal behaviors, those came out to be childhood abuse and relatives incarceration that were most linked to suicidal behaviors. And then finally, suicidal ideation and attempts increased threefold for those with 3 or more ACEs compared to those with no ACEs reported.
Okay, so the risk for substance use in adults increases as ACE score increases. It was found in our research that sexual abuse experienced by women in childhood may be a strong indicator of substance use later in life. However, for men and adolescents, the research was not as clear. This is a relatively new topic, ACEs is, like in the research field. I think the first study was back in 1998. So the researchers are still working out what individual ACEs impact adolescents and men, or impact the effects on substance use. Adults of a higher socioeconomic status have better access to resources that protect against the impacts of ACEs on substance use. We found in a couple of studies, adults who had access to or who had a higher socioeconomic status, they still had the effects of ACEs on substance use, but it was not as significant. So.
Okay, so one thing we found that was kind of true across a lot of our research was trauma-informed care. as a push to kind of help lessen the impact that these ACEs have, and hopefully work to try to prevent them being passed on in any way that we can as providers. So one of the ways that that was done specifically with substance abuse is having trauma-informed screenings, treatment, and health policies that will support just being aware and hopefully working to prevent those negative outcomes, like I said. One study also found that therapy was not as productive if the child's occupational profile failed to take the mother's trauma into account. So I think it is important when we think about, like working with people that we do consider that their previous trauma, both theirs and their parents, is important to what they're experiencing in their lives. And then trauma-informed care can help health professionals teach clients resiliency strategies, further understanding of clients, and helping to change the effect that trauma may have on this client. And finally, something that we found really important was healthcare interventions need to be individualized because every person responds to trauma totally differently. And our current system doesn't necessarily aid in helping this to work. So there's a lot of changes that need to happen, but we need to definitely have individualized care to be effective in preventing this trauma. And if applicable, these are just kind of our key takeaways. So kind of introducing this path training into different settings, because every setting could benefit from having specialized training for healthcare providers and being informed when we provide care to people who maybe are experiencing trauma or have parents who have. And then ACE relating screenings for assessments and interventions are important to be aware of for our practice. And if you would like more information or you want to look further into things, the CDC has several reliable resources regarding ACEs. Yeah. Does anyone have any questions?